Hi everyone, and welcome to our Lunch and Learn Tips from Support. Thank you all for joining us. I would like to begin by acknowledging the traditional custodians of the land on which we stand. Here in Boorloo, Perth, this is the Whadjuk people. I also pay my respects to elders past, present, and emerging. I'm Fiona Burnett, the Customer Training Team Leader for Magenta's Practice Management. Today, we will share with you some inside information from our dedicated and ever knowledgeable support team. On the agenda, optimizing performance, managing user preferences and permissions, using the scanning process folder, ePrescribing and the ERX adapter, and the quick tips the support want you to know. Following that, I will be joined by Olivia McCarthy, our National Customer Training Manager, and Braden Sinden, Genie Magician, masquerading as our Technical Support Team Leader and our co-panelist for Q&A. Optimizing performance. Genie's role as your practice management software is to ensure that everyone at your practice managers, practitioners, clinicians, and reception and admin teams are able to use the software concisely and have that database accessible and responsive. When we talk about optimizing performance, the first thing to consider is how your computers at the practice and laptops alike connect to your Genie server. Wireless connections are not recommended for your practice because these are prone to interference and signal decay. You do really want to make sure that you have a wired connection so that the data that is being sent to your Genie server and the responses that you get is held and maintained securely within those connections. Wired networks are also immune from being affected by interference. Another plus for wired networks is they have a higher capacity than wireless connections. This means they can support more data effortlessly and handle more data traffic without slowing down. So for faster response times and to preserve the integrity of your patient data, wired network connections are the best option for computers and laptops at the practice. Next, you can investigate the internal specifications of your server computer to determine how the Genie application is making use of its available resources. It's the server's job to provide streamlined access to the data that is contained within it. So it's important that your server meet or preferably exceed the hardware specifications outlined. And that certainly helps getting the data in and out of the Genie server efficiently. When adjusted correctly, database optimization settings allow regularly accessed parts of your database to be stored within the system memory of your server. This can really help to improve the speed and accessibility of the information that Genie needs, and it's actually what the end users at your practice will notice. The task of optimizing requires a deep technical understanding of your server's hardware and the specifications it's built to. If you self-manage your Genie server, our support team can help and assist and guide you through the optimizing protocols that we have available. The first step, though, is to ensure that you have access to your server machine to make adjustments to those settings. How you will optimize the Genie server is dependent on a number of factors. This includes reviewing the size of the Genie database, the number of users that connect to that Genie server, and the available memory on your server machine. We have a dedicated section on our Genie knowledge base that addresses optimizing and has guidelines on the specific parameters to address. However, if you're unsure of the specifications your server is built to, or you don't have access to the Genie server, it will be best for you to consult with your nominated IT representative in this case. We recommend IT providers with specialised Genie knowledge and as such, our Certified Advisor program is an initiative that connects practices with our trusted IT partners. A full list of certified advisors is available from our website. On to user preferences and permissions. Ensuring these are correct will enable staff to have the appropriate access for their respective roles within the practice. Setting user preferences and permissions correctly within Genie helps to maintain security and confidentiality. It helps to control access to the sensitive data, ensuring only your authorised staff can view or access particular areas of the database. Permissions prevent unauthorised access or tampering with records and is an integral part of conforming to privacy regulations. Firstly, ensure that the confidential patient data you store is secure. Each staff member should have their own individual login, secured with a complex password. Passwords are to be set for all Genie accounts that are visible on your login screen. It's easier to check if passwords have been set for user accounts. If double-clicking a username allows you access to the Genie database, it's time to set a complex password and discuss your practice security requirements with all staff of the practice. If you have rooms or locations that are set up as users, this will be visible on the login screen also. These user accounts also require complex password protection. Best way to safely store your Genie passwords and any other required credentials is to use an encrypted password manager. Your IT provider can make recommendations if you don't already have a system in place at the practice. Bear in mind, if a user needs to reset a Genie password, the licensee themselves or a pre-nominated authorised representative of the practice are the ones to contact our support team to do so. If you are adding new practitioners or staff to the Genie database, it's important to fill out as much detail as possible for their user preferences to ensure the correct configuration for each new staff member. Let's look at a couple of key points. Firstly, ensure the provider type is accurate. Here, choose general practitioner or specialist, depending on the qualifications. The provider can be set to reception for all other non-billing staff at the practice. Across the other tabs you see visible here, from General through to Eclipse, there are many other user preferences to consider, so it may be worthwhile reviewing how they are set for a current user role at the practice and then reflect those settings for the new users you are creating. On to permissions. The permissions area can be accessed by the Genie administrator or those users who have been specifically granted access. Go to the File menu and then select Edit Groups. This is where you can set, review, or revoke the permission set for Genie users. On the left, under the Group Name section, it's wise to create a group of users who have common access requirements, such as doctors, nurses, receptionists, typists, and so on. On the right is the Members area. This is where you specify the individual user accounts at the practice who belong in each group. And within the middle section, this is where you have the specific areas of Genie that can be checked or unchecked based on the access to be provided. There are three main areas of focus here. It contains general access and task permissions. Also, be aware that the maintenance and reports window be aware that the maintenance window option, which is second from the top here, relates to the maintenance and reports window itself. So any staff requiring the daily banking report to reconcile with the EFTPOS terminal, for example, will need access. However, other users may not have the need to have this activated for them. The second area of permissions is denoted by the $sign, and it relates to the financials within Genie. Payments, modifying invoices, and restricting access to the financial reports are available from this section. There are also toggles for the stock module, and the appropriate permissions should be set here for those who have the responsibility of managing any stock held at the practice. Third area with the patient icon represents your patient-related settings. Here you can configure who has access to view the clinical information of patients, merging and deleting patient data records, as well as other functions. As you can see, each section has its own group of settings for you to configure. If you are interested in learning more about each group and what the individual settings relate to, head over to our knowledge base. There we have a comprehensive list of the categories and their meanings available. The scanning process folder. The scanning process folder allows images and scans to be added to Genie for later attaching to patient files. One benefit of having a process folder set up is that when you receive attachments by email, you will no longer need to print the attachment, scan the document back into the computer to have it available in Genie. All you need to do is save the attachment directly from the email that you're viewing and save it into the nominated process folder. This means no more double handling and wasted paper that's ultimately sent for shredding. To access the process folder, go to the special menu in Genie and click on Image Pro Control. As the Image Pro Control window opens, you can click on the process folder icon to view the contents and proceed to linking the files. On the top left, you have the folder which is nominated to be the process folder. It's good practice to maintain the one folder that is in use as the process folder, but you can change the selection here at any time. If you do have one main process folder available and you do change it, make sure you change it back at the end of your linking session. Good practice is to have the process folder set up as a shared folder available to all users on the network. You may already have a Genie Scans folder set up, as this could be the folder that your desktop scanner saves the scans to. After accessing the process folder contents, you will have a window and it will list the attachments that have been saved to that location on the left-hand side. The right will give you a preview of the document you have selected from the list. It's also easy at this point to edit the details that you see highlighted here on the left in blue. For example, you may have a preferred naming convention at the practice for patient information forms, referrals, and so on. Use a slow double click in the description field or the date field here to update the record. Sometimes you might find that you have multiple documents to attach to the one patient's file in Genie. If this is the case, you can highlight all of the relevant document records and then use the middle Link to Patient button to assign it to the patient. You will also see a To Be Reviewed section here. This is an optional step, but many practices find that this is a really handy and time-saving tool. As you are processing the documents, select a user to review the nominated scans will trigger an alert in Genie to the specific doctor nominated, removes the need to send them a separate task. We commonly see this used for referral triaging or correspondence relating to patients where a practitioner response is required. The provider who has been assigned to review a scan will have a Scans for Review tab pop up on their navigation palette in their Genie. You can also access the area separately by going to the Open menu and selecting Scans for Review. You can refer to our knowledge base for all of the information you need and a step-by-step guide on how to implement the process folder scanning and Scans for Review at your practice. Some best practice methods for using the scanning process folder. Have a shared folder on a network drive so everyone does have access to it. Cloud storage does work well if there is more than one practice location that need to access the process folder. The important thing to remember is to enable offline mode if you're using cloud storage to preserve the integrity of the file and to allow Genie to maintain access to the files within it. Here on the screen, you can see a screenshot from your File Explorer window. If you have cloud storage in place, you will either see the little cloud or the green tick. You want to make sure that offline mode is on by seeing the green tick next to the scan names. Make sure you go through the process folder regularly to ensure that documents are being filed to patients in a timely manner. And make sure you've closed the attachments prior to linking. Where possible, preserve the use for the process folder only for attaching scans to your Genie patients and don't use it for general practice purposes. ePrescribing and the ERX adapter. ePrescribing lets you send links directly to your patients containing prescriptions information. This is fantastic for telehealth and in-room patients alike and works with the real-time prescription monitoring systems automatically when on the latest versions of Genie. There are no additional costs to use ePrescribing. The ERX adapter was a piece of software installed by ERX that provided barcodes on printed scripts, as well as allowing prescription information to be transmitted to the National Data Exchange, or NDE, which is used for SafeScript real-time prescription monitoring. The lowdown is the ERX local adapter is no longer supported in Genie and has been replaced by ePrescribing. If you do require your prescription data to be uploaded to the NDE, you will need to configure ePrescribing for your practice. Firstly, ensure your Genie database is version 10. This is the most up-to-date version available. Next are the regulatory requirements for ePrescribing. Essentially, this includes setting up your practice and practitioners correctly in PRODA, linking your organisation with Magentis, registering with ERX and MIMS. We have a Getting Started with ePrescribing article on our knowledge base for practices to step through, as there are many touch points before we get to the ePrescribing stage. From there, you can move on to the setup within Genie for users to be able to ePrescribe. There are particular practice preferences to configure to ensure that the information is available there to be sent with your e-prescription. The preferences for each Genie user who is going to be using ePrescribing is completed correctly. This includes having their provider type and specialty selected, and their prescriber number and HPI. From the user preferences area, the user can then be activated for ePrescribing under the clinical tab. In the bottom left-hand corner, tick the Activate ePrescribing checkbox. Once activated, the user will need to re-authenticate to process the ePrescribing activation change. It is mandatory to have a complex password set for the user if they are ePrescribing, so have one prepared at this point if it's not already in use. When it comes to patient profiles, there are a number of mandatory fields required to be completed for the patients that you wish to e-prescribe for. This includes having their IHI number, the Medicare or DVA number, and key demographic details for each patient. One last point, we do recommend setting up Google Chrome as your default web browser. Please check all devices or computers that will be used to create e-prescriptions. If you have any questions about changing your default browser, please discuss this with your nominated IT representative or your certified advisor. Once all of these important background configuration steps are complete, you can then proceed to e-prescribe for your patients. Firstly, create a prescription as normal in the patient clinical window. After you have prescribed the medication and click Save, you will see the medication has a tick in the Select column. From there, you can click the ePrescribe button, as you can see demonstrated here. Genie will then begin an authentication process and create a one-time use token for the electronic prescription. When it is successful, the prescription information will be displayed to you in your default web browser. Within the web page, you can confirm the details for the script and generate the token for the e-prescription. This is why we recommend Google Chrome, for the information to be displayed correctly on the screen. The token can then be SMS'd, emailed, or printed for manual providing to the patient or pharmacy. And some final points to consider. You must be connected to the internet to create an e-prescription. This is due to the compliance checks required for you to be able to send the electronic prescription token. Only possible to e-prescribe one medication at a time for a patient. And if an error occurs in the prescription platform or the web page is closed or cancelled, the e-prescription record will need to be updated manually in Genie to ensure accuracy. This can be done by going to the script archive within the clinical area of the patient's profile. Now I'd like to share some valuable insights from our dedicated support team. Related to the optimizing topic we covered earlier, verify your database. A verify can help with performance and also detect potential problems and data corruption early. This is something that can be handled by your IT representative, as it has a look through your Genie database. So it's important that this is run at a time where no connections to Genie are operational. New MIMS prescribing data is released on the 1st of every month, so we recommend updating regularly to ensure your practitioners have the most up-to-date drug information available. As with any updates, make sure one person is responsible for this, and again, it should be at a time where there is one single connection to the database. This ensures the data integrity of the information that you're importing into your database. Fee schedules are updated from time to time, and our knowledge base has a fee schedule status page for you to use as a guide for when new fee schedules have been received by us and when they have been made available in Genie. It's worthwhile checking the page prior to updating your software to keep on top of the new releases available. Prior to attending to any of these maintenance tasks, make sure you take a backup of your Genie database first so you have a safe and secure restore point. From our billing, claiming and financials support team, their recommendations include using the inbuilt appointment book reports, such as check missing invoices, to ensure that your billing is kept up to date. Also, regularly run a check integrity report to pass a fine-tooth comb over the many financial-based data tables stored in Genie. This can be found from the Maintenance and Reports window. We have spoken about getting the best out of your Genie database and your server computer, and it's always wise to seek out professional advice and assistance. Our certified advisors have inside information that you can leverage to get the most out of your database. They can assist with network and environment configuration, and this in turn ensures that your client and server computers are set up to the specifications required. They can test your network parameters and advise on the best setup for your practice. And importantly, they can also assist with preparing for and updating Genie. You can scan the QR code on your screen to be taken to the Certified Advisors page on our website. One of the best ways to prepare for a Genie upgrade is to arm yourself and the staff at the practice with information about what's coming. So make sure you do this in advance. Discuss and plan the upgrade with the practice principal, your certified advisor or nominated IT representative to get a holistic view and their insights. Make use of a lesser known but most wonderful resource front and center on our knowledge base called the release notes. The release notes contain a summary of the updated version, and it itemizes the new features sequentially. It lists areas of improvement, and at times it also takes you through and demonstrates new aspects of the software that will become available. Using this information, it's wise then to reflect on your own practice processes to cross-check if any are impacted, so you can prepare and educate your staff for any possible changes to workflows. For more significant upgrades, we encourage practices to organise tailored learning to provide training on new features and bringing practice staff up to date before an update takes place. Sometimes it's inevitable and you need to reach out to Magenta's practice management for Genie support. And we're here to help. To have the best experience engaging our support team, you can follow these simple guidelines for success. Nominate one person at the practice to be responsible for contacting support should the need arise. This helps to ensure any queries are channeled correctly and avoids multiple tickets for the same issue from the same rooms. Ensure the nominated party has proficient knowledge of Genie and a high level of access, as troubleshooting issues can sometimes require accessing different areas of the software. Communicate to all at the practice that a support query has been logged. And whilst you are speaking with us, it is worthwhile to ensure that we have the most up-to-date contact details for you and the practice staff. As well as reaching our support team by phone, email, the fabulous live chat on our knowledge base, or by using our web form, we also have on offer our tailored learning that includes site visits, remote training, as well as our group training options.